All right, welcome to the second edition of the Make Politics Positive video series. We still haven't come up with an eloquent name for what it's going to be. I was thinking that I was actually thinking that we need some sort of theme music. Like I almost did it myself, like do 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 do, but I don't know. It doesn't work as well when I do it with my mouth.
Yeah,
Um,
if anyone out there is willing to record something, right?
Yeah, something that matches the tenor of what we're doing, uplifting. And Lin-Manuel Miranda, if you see this, I would love if you could record something. You owe it to me after 8 months of being addicted to Hamilton.
That'd be great.
That'd be awesome. I think we would become a phenomenon overnight. So this is the second episode. The first episode, just a reminder of what we sort of the governing philosophies or the core values of Make Politics Positive. There are 5 of them as currently defined. Politics can be positive. We don't have to be just strictly us versus them hating each other. It can be accessible, so making things easy to understand or easy to comprehend. It can be authentic. So we don't have to be afraid of speaking authentically and saying things that other people might disagree with. It can be empowering. Everybody should feel like they have the ability to get involved in the political process, and it should be fun. In the spirit of things being fun, I have drawn some hand-drawn visual accompaniments for our session today. And I'm excited to show them. Stephen has not seen them. I've teased them to Stephen, but he hasn't seen them. So we are going to be diving into. We wanted to start it simple, easy, just go into the kiddie pool. So we're going to start with a topic that a famous current president once said: "Who knew it could be so complicated?" Are the topic of healthcare. Healthcare has obviously been a big issue for the last. It's been a big issue for a long time. Politically, it's been an especially big issue since the Affordable Care Act, aka Obamacare, came onto the scene in 2010. Stephen, where were you when Obamacare passed? Do you remember what you were doing?
I remember watching C-SPAN a lot for someone my age, or I guess any amount of watching is a lot for someone my age. But yeah, I was pretty plugged into it. But I was in high school.
Oh, that makes me feel old. I was almost graduated from college. Yeah, I definitely was watching C-SPAN. As I remember, it was like the last vote before they went on holiday. The holiday break. It was like I think in December.
Yep.
They voted for it. And that was a big deal. As a former vice president once said, it was a big. And then there was a word that we won't say on air, a big freaking deal, as former President Joe Biden once said. And of course, we just had the vote recently where they tried to repeal it. And John McCain, fresh off of brain surgery to remove what will likely be a terminal brain tumor, came in and gave the Roman Colosseum thumbs down to kill the dreams of it. And so now we don't really know what's going to happen. But what we're going to do, the point of this is we're going to be, both Stephen and I are going to identify what we think are kind of the core problems of our American healthcare system, propose some solutions, and then the other person will get the chance to kind of dive in a little bit and ask questions. I should preface this, we are not going to solve, as much as I would like to think we could, we probably won't solve healthcare on the 20 minutes that we're going to be on here today. Probably not. Maybe.
But I would say let's not underestimate ourselves, but
it's true.
It's a big thing.
Lin-Manuel is going to do the soundtrack, and we're going to cure healthcare. Those are our realistic goals for today.
That's right.
So Stephen, and we've actually had debates about this off line. I remember we talked about your stance on healthcare when we were boarding a bus to go pick up a rental car in Las Vegas. And I remember that was the first discussion we had about it. So I'm excited to see you're going to start. I think we agreed to. Give us the Stephen Perkins. What did you call yourself? Conservative libertarian?
A Romney libertarian, something libertarian. Like
Yeah. So and Romney, an especially important figure since he designed most of the Affordable Care Act.
Yes, it's kind of it's not a bad thing, but I'll talk about why I let him off the hook for that one.
Oh, wow. So generous. I'm sure that he appreciates your kindness and grace.
As many Christmas cards that I've sent him, he hasn't responded. So who knows what he thinks. But so you want me to go down the problems, how I see them,
I think that makes sense.
how Steve sees them? Okay. So the first thing, and I think that that this is just in the semantics of everything. I think there's a misunderstanding about the difference between healthcare and health insurance. They're usually used interchangeably. And in healthcare debates, what we're really talking about is how do we get people access to affordable health insurance? The healthcare part is always trickier. And there's different types of debates that even come from that, and also the quality of healthcare. So I think that's the first challenge, is that there's just a difference of different words that we use there.
And so when you say healthcare and health insurance, what sort of things does healthcare encompass, and what sort of things does health insurance encompass?
Yeah, so health insurance is the coverage that allows you to then consume in an affordable manner healthcare services. So something, whether it be as simple as a checkup, that's a healthcare service, or something that is more extensive, like cancer treatment, or something of that nature. So I think that's the difference there. And then also healthcare, you can have a discussion about just the quality of our country's healthcare and how it compares to others, how advanced we are in medical technologies. But that's not my area of expertise, but that's a way you could go with it.
Cool. Thank you. Sorry, I didn't mean to interrupt.
No.
Go ahead.
That's good. The second thing is I think that healthcare as an industry has become uncompetitive. And in many ways, this happened before the Affordable Care Act. But certainly, in my view, the government regulation of the industry has in many ways made it even more uncompetitive. And the free market is not able to operate as it would. Now, I'm not going to advocate for complete free market control. I think there's some common sense things you could do there that the government should be involved in. But I think as a broad sense, it's uncompetitive, and more competition would help. I also think that Obamacare made health insurance affordable for people with low income. And certainly the rich are able to afford health insurance. Talk about Cadillac plans and things like that. I really do think that it became more challenging for middle class people, especially middle class people who are probably not on a company health insurance program. Even people who are in a company health insurance program, it's still challenging for them to afford that. I know for my own family that's certainly been the case there, as well as non-traditional healthcare consumers. So higher risk people, younger people who maybe don't consume or shouldn't be necessarily consuming as much healthcare. And then I would also say that patients are not engaged and in control of healthcare. Part of this is on patients in terms of, as we talk about on this show, this is a challenging thing to understand. I know when I signed up for healthcare the past 2 times that I did it, I didn't really know everything that I was getting there. But really, there's also not as much control there. You've heard debates about keeping doctors, keeping insurance plans that didn't quite happen. And then the last one is, healthcare laws have been drafted in private. They've been reviewed way too quickly by representatives to ever have a fair assessment of whether they're good or not. And they've been voted on in the middle of the night, or they've been voted on quickly and in a manner that the American people felt as if there was not enough consideration given to all the challenges and all the different potential solutions that were offered up. So those would be my core problems with healthcare.
On that last one, it's interesting because I know that was the big Republican criticism of how the Affordable Care Act was negotiated, which in retrospect, when you look back at the number, I mean, I think there were 5 different committees in the House and Senate that were reviewing different drafts of the legislation and had hearings and talked about it. And the final bill was definitely I think everybody was kind of curious to see what was in the final bill, but it was pretty clear what sorts of things were going to be in the bill that they were voting on. And then when the Republicans got the chance to do it this time, there was even more chicanery. Which by the way is one of my favorite words. I don't get to use the word chicanery enough. But there was even more. It was even more secretive. Literally, they said you vote on this bill so that then we can figure out the bill that we actually want to vote on, which comes back to, I think, one of the 5 ideas of Make Politics Positive, that politics should be authentic and should be accessible. And I think that that's what you're talking about a lot is politicians are afraid of telling the people what they actually want, because if they say the wrong thing, aka if they say a policy people don't like, go figure, people get upset about it.
And Nancy Pelosi learned that lesson with we'll pass it before you find out what's in it. That
right.
is communications 101. Let's not go there with it. So
yeah.
More transparency.
All right. So healthcare is uncompetitive. People are not involved in their healthcare decisions. I should just as an interesting point of history, health insurance being provided by employers is a United States phenomenon almost exclusively, and it happened because of when they froze wages around World War II. They had a wage freeze; you couldn't pay people anymore. I think it was around World War II. The way that they got around that was, and I think it started in Texas actually, they started paying, rather, since you couldn't pay people anymore, you said, well, let me pay for your health insurance.
Benefits, yeah.
And that's how it kind of all started as an American phenomenon. And then healthcare laws reviewed in private. So Mr. Perkins, the floor is yours. What are the solutions for that?
Alrighty. So Republicans have come up with a bunch. Unfortunately, a lot of the core ideas that conservatives come up with don't end up making them into final bills, which I thought was interesting. Like one of the things of buying across state lines, to my knowledge, was not a thing in the latest bill. So, but I have a few. I think the first is making insurance portable between jobs. And having it paid for with pre-tax dollars to where people can get health insurance when they start a job in their youth and carry it with them, that policy, carry it with them throughout their career, and not have to. I think that removes a lot of the confusion around health insurance. Is just get a plan that you know and that can grow with you and kind of scale with you, and have it portable throughout jobs. The other thing is to remove the government's profit-making mechanism for healthcare. So the healthcare law, the Affordable Care Act, levied taxes or fees or whatever you want to call them. But in addition, there were 19 revenue-increasing mechanisms. One of them was the tax on Cadillac plans. And I don't think that the government should be making a profit from an industry like healthcare. There's certainly.
And when you say profit,
revenue. They're making revenue. Sorry, Let me be clear on that. And also part of that is I would equalize the tax treatment. So, and maybe it's something like having that tax subsidy, since people would ideally be paying for it outside of the job. Having something like a flat tax to where people, or a flat tax credit to where people can purchase that. And again, kind of working within the pre-tax dollars there.
Why expand on that a little bit? Why is it important in your mind that there's a flat tax as opposed to what usually, and I think what is in the Affordable Care Act, which is more what they call a progressive taxation, where wealthier people are paying more, not in general, they pay more on their highest income. So everybody pays the same thing on dollars 0 through 100,000, but then dollars 100,001 and above get taxed higher. So why flat tax as opposed to progressive taxation?
I would say just the flat tax credit, which is what we're talking about, the tax credit there. It just equalizes the tax treatment for individuals who are purchasing that healthcare, and also under my solution would be that choice to purchase healthcare. So there is maybe changing that individual mandate, which I know we'll talk about some risk pooling and things like that. But I would also remove that part. And then in addition, I think the biggest thing is empowering states to experiment with with some potential solutions. One of the things that I think federal government should be in charge on a big picture level of taxation and top level regulations, but the states should be able to experiment there. Being able for states to open up interstate competition, so buying across state lines, I think would be a really valuable thing. And actually, that's one of the solutions that I think both people on the left and the right can come together on, is that interstate competition among insurance carriers and trying to defeat that. The monopolies that sometimes get created within states. I know here in Texas, there's 2 or 3 major companies that you can choose from, and options are very limited. I would also say allowing pooling to where organizations, membership associations, religious organizations can sell group insurance to people, which would also allow them to determine what they cover. So I do have a couple of challenges with the essential health benefits or the essential health, the essential things that health insurance must cover under the Affordable Care Act. Not many of them, but some of them. And then also my last solution, and this is not so much a government thing, but I think America needs to, shocker, become a bit healthier. The government does have a role to play in it. Government recommendations about health and diet and exercise are laughable if they weren't so I think detrimental to our nation's health. But also just it's part of putting patients in control of healthcare is also in an ideal world, right? Because that's what we're talking about. If this was an ideal system, people would we would be reducing the risks that we even have in the first place by having a healthier society. And in addition to that, I will make one note and say that I'm a conservative who believes that we spend too much on defense. So that sets me up to just say that in terms of spending, I don't necessarily agree with the notion that we can't spend money to help people in need. We spend more in healthcare than most other nations that are comparable to us, and the level of care is actually not that much better. Mm-hmm. We do just about as much research as any other country like us. We have pretty much the same level of healthcare, but I do think that when it comes down to the people who really need help, we should be prioritizing government spending in a way that helps them, which I fully acknowledge conservatives do not always. They do a very bad job of putting the people in those tough situations first. But I do want to make sure I get that note in of I want to help them out as well.
And what that sound that you heard far away is your invitation to CPAC next year. Just read it up.
Yeah.
That was so you said portable healthcare plans. I think that's a great idea. I think that the marketplace in particular is kind of a starting point for that. I think the marketplace was a pretty brilliant and really important part of what happened with the Affordable Care Act. Prior to the marketplace, you didn't used to have, there were two things. One is buying insurance was terribly complicated because you literally just had to go to everybody and they'd give you big stacks of different information. It was always really hard to figure out what it covered. And I don't say this with experience. I was, I was 22 when that had happened and never purchased health insurance, but I do know that was that was what the intent was. And there also just wasn't like a centralized place where you knew the plans all had to cover the same basic services. That was another one of the big things that the Affordable Care Act did that I really appreciate is it was guaranteed issue on certain services. If you were going to list on the marketplace, you had to provide A, B, C, D, E, F, and G. And I think that all of that is great. And I think that if the marketplace could be expanded to where more plans were involved, then I think that what you're talking about, where somebody could have the same plan their entire life, could conceivably happen. I know that we work at the same company, and when I first started working at Tri, I didn't take the health insurance that they offered because I had health insurance through my parents. And then the first year, I actually purchased off the marketplace because the plan that they had that best matched the level of care that I usually need was cheaper than going through work. So I think a little bit of that already exists, but I think it can definitely be stronger. And I think that strengthening the marketplace in particular can come from that. And this is going to be one of those things that I don't know enough about it to be able to have any complaints. I think that interstate pooling, the choice to purchase healthcare from across state lines, I think both of those could definitely be looked into. I think one of the big challenges that comes when you do that is, of course, states have different regulations and different rules in terms of what you've got to cover. If you go to Oregon, for example, we have a rule that all health insurance plans must cover, not just contraception, but must cover abortion. Mm-hmm. And if you go to Texas, that is it's been a prevailing theme of the legislation passed in Texas is like they're very much against that. So there's a little bit of that. You'd have to figure out what are the commonalities and what's the common ground.
And that's a great note. And what I'll say, what has been done there, our states have come together and work with each other. So it wasn't the government right now doesn't necessarily promote that idea, but there have been states that have come together and worked to provide that interstate competition. So I think that's the route you could go down with it, is empowering them to be able to do that.
Yeah, and I could see that, and I think that's worthwhile. I think that removing the healthcare taxes it was interesting. You started with the word profit, and I caught you on that because obviously nobody's directly profiting from government. There are clearly a lot of people who profit as a tangential, as sort of a side hustle. But I that's the only one of what you laid out that I think the reason why the taxes were on. So when you say Cadillac plans, if you're not one of those people who lives and eats and breathes healthcare, Cadillac plans were considered like the plans that were, if you go on the marketplace now, they'd be what would consider to be a platinum plan. So they have very, very low premiums, very, very low, usually because your work is paying them. So higher premiums or your work is paying for most of it, but low out-of-pocket maximums, low deductibles. And so as a result of that, the reason why they tax those specifically is because those types of plans tend to lead to an overconsumption of care. People are like, oh, I've met my deductible and my out-of-pocket maximum. Doctor visits are free for the year. Let's go wild. And I will say that the out-of-pocket maximum is a powerful force in healthcare decisions. I know that that's the number one thing that I look at when I purchase healthcare is what the out-of-pocket maximum is. My fiance, who's been dealing with an eating disorder for the better part now, over a year and a half, and who has lupus and gets very expensive infusions for it, like the out-of-pocket maximum is really our driving factor there. But I think the idea is part of the reason why healthcare is so expensive is because Americans, in some cases, overconsume healthcare, and in some cases, underconsume healthcare. If we're talking from an economic sense about incentives, if your healthcare is free, you better bet you're going to go into the doctor and be like, load me up with all these things that could help make me healthier, but also like if I was paying directly for them, I might postpone to another year.
Mm-hmm.
Health insurance in general is sort of this. It's an interesting concept because it's good in a lot of ways. I'm happy that people have health insurance, but in a lot of ways it sort of distorts the incentives that people have to either get care, or if they don't have health insurance, to skip care. So I think those are reasonable solutions. I think that, I don't know if that fix everything. We'd have to submit it to the Congressional Budget Office. See what they
Sure.
think about it.
And then one more thing, because I forgot to include it, but it's a small part. Health savings accounts, which we already have. I have a plan with the health savings account. And it's really great for people who either don't consume a lot of healthcare or consume a lot of healthcare. I would look at removing the limit that people could contribute to those. That's a proposal that Senator Rand Paul has proposed, and of course that's all pre-tax dollars that you're contributing to those as well. So just last note.
Pre-tax is one of those words that I feel like is like the dividing line between people who are wonky about it. But like I would feel like most human beings don't walk around talking about the difference between pre-tax and post-tax, which is good. Like I think that's great. Like I'm not saying that's good or bad. Like that's like it's one of those things that when you say, I was like, yeah, I feel like I talk a lot about pre-tax stuff.
I look at my deductions every paycheck, and I long for that pre-tax money, Curtis.
Now you're sounding like now you're CPAC is unshredding your invitation, sending it back to you. Do you mind if I share my kind of view on things? Or
please do. Yeah, go ahead.
So we'll start by talking about as the liberal progressive on this, and I heard a really interesting podcast on from Ezra Klein, who you recommended to me to listen to his podcast.
Yeah.
Again, CPAC shredding your but there was a really great article about, or a really great podcast about labels and identities, and this actually I think would be something really cool that we could get into next time, of talking about like the way that people's political identity shapes the way they get information and news and the way that they get angry about certain things. And I think that's definitely a future topic. But I just say that as I struggle to figure out what I define myself as, a liberal progressive or whatever. I will say I have liberal progressive views. So the big one that of course most, I think, progressive folks dream of, and which most of the developed world has, is some form of single payer healthcare. Single pay and single, as you said before, single payer health insurance is really what that is. But what it boils down to is everybody always has access to care, and you don't have, so long as it is under what the government says they're going to cover, you don't have to pay it. There is one payer who pays all the hospital bills, and it is the federal government. You could do it at the statewide level, and I know a couple people have actually tried, but usually you have to get a little bit bigger to get kind of the economies of scale that make single payer work. As I said, most places in the world, most in the developed world, have or are mostly single payer healthcare programs where the government is paying for everything. There are some pros to that. One is you don't have to worry about getting sick and dying and not being able to pay for it. That's a pretty good perk, assuming that the government covers what you are sick with, which in an ideal world, they would cover most of the things that people get sick and die from. So that's one of the benefits. The second benefit is that the government then has the collective bargaining power to be able to, they have the collective bargaining power to be able to negotiate prices. So rather than your insurance company and my insurance company and 17 other insurance companies all going and negotiating prices, the government comes in and says, hey, if you would like to be a healthcare provider, these are the costs that we want you to pay. I remember when I was in freshman year of high school, my marketing teacher, Mr. Compton, used to talk about how, I think it was Arm & Hammer, or one of the big, Procter & Gamble, one of the big companies, that you don't get to pick what you buy Arm & Hammer toothpaste for. They go and tell you this is what you're going to buy it for, because you are either going to cover you're either going to provide this product that everybody wants, or you won't. And so they know that, and they have the negotiating power and can come in and say, this is what we're going to provide. So that's another one of the benefits from that. And I think those are really the two biggest things. The costs are lower because of the bargaining power of the government. People don't have to worry about being sick and dying and not being able to pay for it, or on the other side of that, getting the care that they need and then going bankrupt because they're uninsured and can't pay for it. So I think that I think single payer, and that can look like, I know that in the 2010 healthcare debate, I know that for a brief shining moment, Joseph Lieberman came and said, we should do Medicare for everybody. And I remember when that happened, that like every liberal commentator in the world was like, yeah, we should. Why do you think that? Because you hate liberals. And then he realized that liberals liked it and was like, never mind, I didn't think this through, and then went for something else. So that could look like Medicare, which is currently available to people 65 and older, being available to everybody. They don't have to purchase into it, but they have the ability to. That would be a very easy way to make that happen. And I think some of the shortcomings of that are that anytime the money hose turns off, there are going to be pains from that. So as you talked about defense spending, if you were to stop spending so much money on defense, there'd be a lot of people who would be out of a job pretty much immediately. That's not an argument against lowering defense spend. Well, it is an argument against, but it's not necessarily a great one. But that's one of the things. If you were to suddenly lower the amount of money that was going in, you'd probably have some transition in terms of who worked where. You'd probably have some hospitals closing. You'd have some transition there, which, as you talked about at the beginning, the whole, you can keep your doctor. I see people accuse Obama of saying that was a lie that he told, that he lied to the American people when he said, you're going to be able to keep your doctor, which is interesting because a lie usually is when you know that something is untrue and then say it anyway to try to persuade them. And I think that Obama thought that that was the way that it should go, that everybody should be able to keep the doctor, and then unintended consequences was those doctors or plans went out of business, all of which is to say. Stephen, let me introduce you to a couple of my friends.
Are
And by
these
the
the
way,
visuals?
these are the visuals. How
Good.
old are you, Stephen?
22.
22. I was gonna guess 23, so I'm happy I asked. I'd like to introduce you to a couple of my friends. The first person I'd like to introduce you to is my friend Stefan. Stefan is 22 years old. He lives in Texas. He's a lifelong Texan. His likes include Katy Perry and Kanye West, and two of his favorite artists. This is not you, Stephen. This is
Oh, yeah,
different
sure.
dude.
He sounds great.
Yeah, he is. He describes himself as a Romney libertarian, and as you can see, his health issues are none. So Stefan. Like the pronunciation is very difficult. Stefan. Stefan is one of those people who is a young, healthy person who, as you talked about, the choice to should Stefan get to choose whether or not he gets health insurance. Should he be able to opt out? Then I'd like to introduce you to another good friend of mine. I would argue potentially even more handsome. His name is Curtis with a K. Curtis with a K. You can see here that he is 29. He lives in Oregon. His likes are also Kanye West. This is why Curtis and Stefan are friends. And then also the musical Hamilton, Lin-Manuel. Please pay attention. And then you can see here that his health issues were at the tender age of 24. He got diagnosed with brain cancer, and so therein lies the individual mandate and the reason why it is important. The reason why it's important for everybody to buy healthcare. Curtis, when he was 24 in a pre-Affordable Care Act world, when he got diagnosed with brain cancer, would not have been if he had the ability to not choose to get insurance, suddenly lives in a world where his healthcare bills were in the, I think, by the way, we'll break down this for a moment. I actually did get brain cancer when I was 24, and I actually did get about $110,000 worth of health care. And the only reason why I am not bankrupt and why I live in a building instead of under a bridge is because the Affordable Care Act, allowed me to stay on my parents' health insurance until 26. But B, even if I had been 27 when this happened, it also allowed me to, or it required me to purchase insurance and said that health insurance companies couldn't deny me based on pre-existing conditions. So people want to know, why is health insurance so expensive because of Obamacare? Why are all these plans getting out of it? And the answer comes down to risk. Stefan, at 22, is a very low risk healthcare consumer. Health insurance companies love Stefan because he is going to come and he is going to pay for health insurance and probably not consume very much health care, which means that his money that he goes toward health insurance, I have one more group of people to introduce you to, he gets added to the risk of 300 million Americans. Don't count, Stephen, there's less than 300 million of them. But his risk, his very low risk, means that the money that he's not, the healthcare that he's not consuming, that money gets to go toward covering all of these folks. In this group, you have old people who have lots of health problems. You have young people who have very little health problems. You have young people who have lots of health problems. But the risk is shared and pooled across everybody. That's probably the biggest benefit of single-payer healthcare, is that no one person has to bear the risk of getting sick. If you're Stefan, your risk is low, but that doesn't mean that your risk is non-existent. Curtis is upside down. That doesn't mean that your risk is non-existent. And so a big part of this comes down to the concept of risk. And the hard part about healthcare is, for the most part, people don't earn their healthcare problems that they get. Going back to the story of me getting diagnosed with brain cancer at 24, it's not like I was putting my head in the microwave every day or going and playing around toxic waste. Like, I just happened to get a bad luck. And so as a result of that, I got sick. And because of the Affordable Care Act, that risk had been shared with enough people to where I didn't have to go bankrupt. Now, in a world where the Affordable Care Act doesn't exist, and I still get brain cancer, and I do go and get $120,000 of health care, What I would do, and what most people were doing before the Affordable Care Act, was would file for bankruptcy. When you file for bankruptcy, the hospital doesn't just be like, okay, I guess we're not getting paid for all of that. Instead, they take those costs and they share them to this familiar group, the 300 million Americans. This is the big reason why healthcare is so much more expensive in the United States than it is in most other places, is that you had people who were getting huge medical bills that were then just not paying them and passing them along to everyone anyway. But in the process, you had debt collection efforts and you had all kinds of other things that were going into that. All of which is to say, the more people who are covered, the more people who have the ability to affordably access, I'm going to argue, the better country we live in. Talking about values, I say this all the time. I want to live in a place where you, Stephen, and me, Curtis, and our marker doppelgangers don't have to live in a world where you fear getting sick. I think just as human values, if we live in a place that represents the kind of country that we want to live in, that aligns with my values. I tell that to conservative people. Why should I have to pay for your health care? And my answer is, I'm happy to pay for your health care. I don't want anybody to have to get sick. Like, I don't want anybody to have to worry about dying. And I think that's sort of like a common humanity thing. And I get that it's more expensive for your family. It's been more expensive for mine, too, to pay for it. And a lot of the reason why, and this comes back to, as we talk about risk, when the Affordable Care Act was invented, there were these things that they had called risk corridors. They understood that if you let everybody have health care, that there's going to be a lot of sick people who suddenly are requiring a lot of healthcare. And so the federal government said, we will help support any healthcare plan, health insurance plan that has that gets a lot of sick people on it. We're going to pay and subsidize that to where you don't have to raise your plans real high. And then our good friend Marco Rubio, senator from the state of Florida, he cut that out in one of the government spending bills, and as a result, that has caused pretty directly a lot of the issues that you're seeing with health insurance companies going out. There's less competition, et cetera, et cetera, et cetera. So those are, again, I don't know if I proposed a solution so much as just a set of principles and ideas, and why I think that the more people you cover, the better it is. And I'm going to say, I don't think you should be able to choose not to get health insurance. Because everybody, regardless of being sick, has that risk. And that risk is always, whether it's directly or indirectly, that risk is always passed on to everybody. If you get sick and declare bankruptcy, I still pay for it through higher health care. So those are sort of that's the problem. There's I guess, a little bit of the solution. What do you think, Stephen?
Yeah, no, that was good. And you provide some context there of being in a position where you, at a very young age, in a group that's traditionally low risk, you did have, those major complications. So I think that was good context. So high risk, or the risk corridors, those could also be high risk pools, is what they would also call those.
Yeah.
Yeah. Okay. Yeah. Cause that's the terminology I usually have heard. So I agree that the more people you have in a market, the better off the pricing in that market will be, and just the quality of that market. I think that's a given there. I have a couple of challenges and really just questions, I guess, for the single payer type of system. So the first one is, would you not have then that same challenge of overconsumption if you have this universal access and also, you could say low cost type of access to coverage? Would you then have a overconsumption of healthcare services?
That's a great point, and actually, totally right. Like, that's one of the things I think you pointed out on our offline conversation we had about healthcare once. If everybody has the ability to get healthcare, do we have the doctors and nurses and hospitals and specialists? Do we have the ability to be able to provide for all of those? And I think part of what that looks like, and part of the reform that's needed, is there do need to be more doctors and nurses and specialists and hospitals and all of those sorts of healthcare professionals that can help provide for that. It's funny because going back to the healthcare debate, when you think of like Sarah Palin, everybody's favorite politician, talking about death panels. This is the kind of thing that she was talking about. Of course, she had to take it to a totally unnuanced, anger, making it sound like the government's going to come and line you up and shoot you.
Surprising for her. Yeah.
Right. Yeah. Yeah. But that is the kind of thing that you're talking about, of like, you get into a situation there where the government then has to make decisions about how much care to provide and what sort of things are covered. And my understanding is, in most places where there's single payer, the government says these are the things that we guarantee that we will provide for, and they're critical medical services. But if it's thing like you want to go get physical therapy, you either have to pay for that out of your pocket, or you have to get a supplementary insurance plan that will cover some of that. I don't think the idea is, hey, you're sick, you should, and when I say sick, hey, you've got a cough, you should definitely go to the emergency room and spend a night in the hospital to worry about that. I think that the idea is single payer should cover things that would rise to the level of what I would say is a medical necessity, and then anything other than that, you've got to go get private insurance for, or you've got to pay out of your own pocket. I don't think that you can just, we don't want the government paying for cosmetic surgery. No, we should not all be paying for that unless. And I think that there are some exceptions to that. If you have massively, disfiguring facial, something that's going to affect your quality of life, I think that that's the sort of thing that, yeah, that's a reasonable medical necessity. And again, these are the kinds of like bureaucratic questions that people, will rail against the government to make, but they're reasonable things to have to make. And that decision, it's interesting that Sarah Palin as a conservative was decrying that, because really, like, the opposite of that is everybody just gets whatever care they want, and that's a terrible system, like a way worse system. So I think that that's my impression, is that you cover medical necessities. If you want to go get lipo, if you've got, I think that the government could cover some of the costs of things like, I've got what was called a pelvic upslip on my hip. I would argue that the government, that can turn into a medical necessity. So maybe the government's paying for part of the coverage of that, and I'm paying for the rest. But I think there's room for discussion there. But I think in general, government covers medical necessities, things that you don't have any choice over, or things that will drastically affect the quality of your life. And then otherwise, people have to supplement that. Is that a fair answer to that?
Yeah, that's fair. I mean, it's kind of like we've seen it in other countries, right? But there's still that whole factor of America's a bigger country than a lot of countries, and all sorts of other things in play. And also, interesting, you mentioned the supplemental insurance, because a lot of people, at least on my side, will look at countries with single payer and go, you see those people, they have to get private insurance, and usually it is just supplemental for some bigger, things that are outside the scope of, I guess, essential healthcare services. In terms of generally as a conservative, because I have to represent this part of the ideology, I have a challenge believing that the government can effectively manage such a program. And moreover,
because there's not proof of other governments doing that other places.
Well, arguably, there's still a lot of, even in countries with single payer, there's still a lot of challenges they have. Like, they haven't implemented single payer, and then the debate's been over and they live happy. Like, there's still challenges with it. Now, granted, we still have challenges without it, but part of the bargaining power, which I think is incredibly powerful, you have to have some sort of bargaining power to reduce prices. To me, that means that there has to be an ability to walk away. And if the government is guaranteeing certain healthcare services or benefits, they can't walk away from a provider. They can't really have as much bargaining power as you would imagine, because they're not able to abandon that negotiation, if that makes sense.
So you're saying that, like, if the government goes to a hospital and they say, hey, we're going to pay you X dollars for these services, and the government says, and the hospital says, we need more than that, that the government would then, you can't just say, okay, then we won't use that hospital. Is that kind of what you're saying?
That's one of the challenges, is that the government can't really walk away if they're guaranteeing certain things being covered.
Yeah, and I think that so it's setting prices of saying, if you provide open heart surgery, this is the rate. And I understand there's complications for that too. Like if you go in there and there's some other thing that needs to get done, or you slice a vein and there's,
Sure.
like understanding that. But I think that there's different prices, and the negotiation part is the government has an interest in those businesses staying in business to provide those services. So you can't just go like, hey, you're going to provide everything for free, because that doesn't work either. There has to be some level of negotiation. And I think that if both parties come in good faith and say, we want to make sure that you can stay in business, but at the same time, and this is one of the sickest parts of American healthcare, the people who are providing healthcare and the people who are providing health insurance are profiting off of it and do have shareholders that want to profit off of it. And that profit motive is the most disgusting, distorted, like I was an econ major. I'm pretty pro, like pro economic development, but having there be literally a profit motive to deny you care and to deny you service is a sick incentive that absolutely needs to be taken out of the equation. You can't have a system where the incentive is our shareholders will be much happier if I let you die. That can't exist. So I think that's part of it, is being able to keep them in business. But also people, I think that the speculation, and that's really, I mean, if you look at the stock market as sort of like, it is a little bit of speculation, then of sort of like making a gamble and hoping that it pays off. I think you have to take that profit motive out a little bit, and it has to be like, healthcare should be boring, dry, predictable. Nobody should be like, what's the market going to look like next year? Ideally, there's going to be as much stability and predictability as possible. So I think the government comes with the negotiating power and says, this is what we want to pay. This is a standard rate for everything. The hospital comes, they say, here are costs. And I think you can do some analysis, like, are those costs legitimate? Did it really cost you $90 for a syringe? Or where is that coming from? So does that answer your question?
That does, yeah. And you do see, I mean, it's certainly charging, what is it? I can't remember the exact example, but like an IV bag that costs maybe less than a quarter, and they're charging $100 for that.
Right, so, which comes down to Curtis with the K and his constant bankruptcies that those hospitals have to recoup some other place. Mm-hmm. And it's usually being like the $90 price tag for an IV is not actually what insurance companies are paying them. That's if you don't have insurance and come in as some person off the street, what you're going to pay. Right. But again, all of that comes back to people not being covered and the profit motive element of it as well.
And I just keep coming back to the challenge with believing that the government could effectively. Because when I look at government projects, or when I look at government involvement in other industries, I think, for example, one that is also a big topic right now of education and the price of that, and how the government not only profits off of education, but colleges raise the price of tuition because they know that it's going to be supplemented.
Right.
I have a challenge with thinking that the government could be like. And I know we're talking about ideal world again, but that's kind of the challenge, is the ineffectiveness of government involved in that.
And I think that I'm not telling you that the system would be, like you said, smooth or without challenges. And I think the lesson there is all systems have challenges. Mm-hmm. Certainly the American system has challenges. The British system, I know they're constantly working on NHS, and there are a lot of challenges everywhere. I know a lot of people fly to the U.S. to be treated by specialists here because we have some of the best specialists. That's one of the pros. Also, a lot more people get sick and die without treatment here, which is one of the cons. I'm not claiming that it would be perfect, but again, I think it's more predictable. I think it's more stable. I think that you get less of this, like, am I going to live or die? Am I going to go bankrupt because of this? And that predictability is hugely important in something where if people don't have predictability in their healthcare, that it just adds another layer of terror on top of what's already, when you get sick, it's already a very scary thing.
Sure.
I don't think I won't say the government will do it perfectly, but I do think that, like, if you look at something like Medicare, most people are very happy with Medicare. If you look at something like Medicaid, most people who have Medicaid are very happy with the treatment and care that they get under Medicaid. Most of the states who are having the worst healthcare are the people who denied the Medicaid expansion. Medicaid being like insurance for poor people, basically single payer insurance for poor people, or closer to a single payer model. And so, like, I think that there are already the government is administering some of those programs that most people are very much in favor for. If you were to go to a 65-year-old person and say, we're going to get rid of your Medicare, I think they'd be very upset about that. And I think that's proof that it can and does work. Certainly there's kinks, but if I would rather live in a world where everybody doesn't have to worry about getting sick and dying and going bankrupt for it and have to deal with how do we, tweak the mechanics, than a world where we try to just make the Wild West work for everybody, is kind of where I land on that.
Yeah. And I think with both of our ideas and plans, at least I think so. I think you noted it earlier. We kind of this idea that healthcare the specifics of the national plan and the specifics of people's individual plans should be something that people can understand. It should be, when we talk about politics, should be accessible, and it should be in terms that people can understand. Certainly healthcare is one of those areas where, you don't know all of it. I don't know all, because it's such a complicated system, but at least providing some clarity to this world,
right,
whenever Congress is debating it, and because there are big changes at the end of the day. And I think a lot of the frustration and the people being scared at potential changes, I think a lot of it is just because they don't really know what we even currently have, and let alone what we're looking to go to. So
yeah, well, and it's interesting because I think that there are, as is the case in most political issues, there are a lot of people who are sort of acting in bad faith. Sarah Palin's death panel's unnecessary fear-mongering of something that is actually a perfectly legitimate government function. I think in general, anytime somebody is trying to scare you over something, you should look very skeptically at that thing, because very few things, like most of the people who are in government aren't like, how do we come up with the most diabolical policy possible? But we all know that the game of politics is just sort of this: how do you get people angry, or how do you scare them? And yeah, I think that there is a space to have more conversations like this. Like, half the things that we said could be made into an attack ad on a politician. They want to take away your rights, like whatever it happens to look like. But I think that, yeah, having conversations like this and being able to explain it is pretty important, because most people don't understand a lot of this, and it's not their fault. Unless you are watching C-SPAN or reading Vox, or like whatever you happen to be reading, it's hard to understand this stuff, and it's hard for it to be accessible. Any final thoughts as we wrap up?
Other than it's been a challenge really since, I guess, the Clinton years. I guess it's going to be a challenge for the foreseeable future. It looks like Republicans have backed off their intentions to change it a little bit, but I do hope that people can have more conversations like this, where it's not, well, you just want people to die, and you just want me to have to pay more, and things like that. So I think this is a good framework.
Go figure. There's more nuance to the world than that.
Imagine that.
Hey, I will be Stefan in the mail this week, so you can put this up on your wall.
Perfect.
Curtis will be hanging out here. By the way, I want you to notice the detail that your lips and my lips, different color. Like, look at that artistic ability here. All right, that is Make Politics Positive, episode 2. It's in the books. I'll see you later, Stephen. Adios.
Bye.